right, welcome to another section introduction here. I am Dr. Laurel Barr. I am the chair of the formerly YPS, now the Early Career Physician section. And I am here with the chair of the Pediatric Emergency Medicine section, Dr. Shiva Kalidindi. Thank you so much for being here today. Tell me
Thank
a
you
little
for
bit
having
about
me.
tell me a little bit about your background and how you got to be the chair of the section.
Yes, thank you for this opportunity. I am a pediatric emergency physician, and my background is having completed pediatric residency, went on to do my fellowship. And for the last 20 years now, I've been practicing as a pediatric emergency physician. Um, in terms of my involvement with ACEP, since graduating, I've been a member of ACEP, and I feel ACEP as being my professional home. And as part of that, I have tried to be active and contribute both in the regional ACEP group, the FCEP, Florida College of Emergency Physicians, and at the national level as well. In terms of my contributions, I have been contributing towards the education programming and the administrative component of Florida College of Emergency Physicians. In my capacity, I served in the past as the chair of the Pediatric Emergency Medicine Committee for the Florida College. And currently, I serve as the chair for the Florida College annual conference called Symposium by the Sea. And if you haven't been to the conference, I would highly encourage you to join us. It's a wonderful conference, usually held by a beach resort, and we have a really good time. And it's a great place to network as well. So that since the last 5 years, I've been more involved with the national ACEP, and I've started this year in my capacity as the chair for the American College of Emergency Physicians Pediatric section, and I get to work with a great leadership group and wonderful members of the section. And we have good representation across the nation from coast to coast and everything in between. So we are a fun group. And yeah, it's a great place to work together and contribute towards pediatric emergency medicine.
Well, what a great place to be right now in Florida by the beach with a symposium. I know the symposium's not going on now, but we are recording over spring break and I'm in Ohio, so you are where I want to be and
You're
probably where
welcome to
most of my
join us.
friends are.
Yeah.
Well, awesome. Sounds like you've been greatly involved in contributing towards education in pediatric and other aspects of ACEP. So thank you so much for doing that. The mission of the section is to advance quality pediatric emergency education and promote the interests of emergency physicians caring for children. So to me, that involves creating all these references that I can use on shift because you get a sick kid and it hits the fan. I don't have the opportunity to read a whole textbook. I need a quick hit right here. So it sounds like this section is really contributing to pediatric emergency medicine education and just involvement in general. So tell me how you do that and what the best things that you do are.
Yeah. And it's mostly thanks to the members of the section who are active and contribute towards this content that is available. So the mission that you alluded to for the section is twofold. One is to be able to advance pediatric emergency care and education. And the second, for it to serve as a professional home where we can promote the interests of emergency physicians who care for kids. So those are our things. And they both tie in together well because as when we create this content for in pediatric emergency medicine that is readily available for a quick hit or be able to quick review a morsel or something along those lines. It allows for people contributing it to advance their careers as a scholarly activity or otherwise, and for our end users, our physicians and community doctors and emergency physicians caring for kids. It serves as a quick review of content that they can look into. And We try to do this in the form of webinars and also content on the website or our section site that we keep updating. To that effect, if I may, we are trying to recognize what is the hottest topics, what are the latest topics that physicians are looking for in pediatrics. And based on those topics, we are trying to see what is the more practical, pragmatic, evidence-based, practice-changing content that we can have on the site. And that is what we are soliciting our members to contribute towards, and for our members of our section to benefit from it as well.
Yeah, and lots of great pearls in emergency that really adult docs like me just need quick access to. So if you're the type of person, I'm guessing, that is still trying to figure out an Alti versus a brewery, I need your section contributions. But to those who that's down pat and who sees kids all the time, how are different ways for us to get involved? So what can we expect if we join your section? Things that will benefit us, and then how can we contribute to all this great content?
That's a great point that you make. Some of us practice just pediatric emergency medicine. So I wouldn't say we are completely comfortable in the space, but we do it often enough where we develop a certain amount of comfort, and we still need to be up to speed with all the changing landscape of medicine and the latest evidence that is out there. So even for the pros or for physicians who are looking for a quick review that they would require, this kind of content, this kind of practical content will be helpful for them uh, to just refine their skills, hone their skills, or the knowledge database that might be there. So along those lines, when it comes to pediatric emergency medicine, there are certain things that are unique with kids that is quite different from how adult medicine is practiced. Having said that, uh, 30% of all visits to an emergency department are pediatric patients. Just getting comfortable with caring for kids is one of the things that all of us strive for. And to that aspect, you alluded to Brewi. A quick update on Brewi. What is the criteria? What is the low risk category for a child? What is the high risk category? And in which case, what investigations would you do? How would you stabilize the patient and how you would dispose the patient? Something along those lines would allow for a practicing emergency physician to feel comfortable. Okay, uh, that's the gist of what I need to know to be able to care for this kid. So those are the kind of topics that we are looking for, uh, and we are trying to understand the needs out there as well. What are aspects of pediatric emergency medicine that one is feeling uncomfortable with, and make sure what are the practical evidence-based tips that we can provide that would allow for you to care for the pediatric patients is what our goal is for. And in the process, what we are doing is we are striving to uh, work towards gathering that content and be able to review it, make sure it's up to the mark, and then have it available in the form of webinars or on the website. So, if I could expand on that further, one of the things that we recognized is caring for kids who are presenting for the very first time with a seizure, the first time seizure episode, either a febrile or a non-febrile seizure episode. So in May, we are hosting a webinar with content experts to be able to guide us as to how we can navigate caring for the kids who present with this first time seizure presentation. What are the red flags that we need to look for while we care for those kids? And what kind of follow-up or care can ensure that the kid gets the appropriate care.
Well, you're hitting the nail on the nose. I think my last pediatric patient was a first-time febrile seizure. So all that good content at your fingertips.
Yeah, and it can be challenging. And I think when we say caring about kids, it's not only the patient that we are caring for, but for the family too. What are things that we can tell a family member when they're worried about their loved one, to be able to put them at ease. What kind of anticipatory guidance can we provide them as they care? Uh, those are some of the practical tips that we hope to cover as part of that webinar.
Right. And like you said, after you stabilize the kid, putting the family at ease. And it's really great to have those resources because this febrile kid, they were okay. Parents were freaking out a little bit, and it was really helpful for me to have the statistics available at my fingertips about how many were going to go on and what the chances of recurrence was and what to do in the next 24 hours. So it was really good to have that review just clinically on shift. Can you tell I use your resources?
Thank you. And that makes the members that have contributed, and it makes the purpose and mission of the section that we are striving towards it. So thank you.
Well, and to that effect, all this great educational content, different formats, just, clinical resources, podcasts, webinars. Sounds like we've got a great upcoming webinar coming on, contributed to your receiving the Service to the College Award. So congratulations on that. That was last year's award, I believe, presented during council, and because of all your great content.
Yeah, thank you. It was because of all the contributions of our members, and I'd like to recognize the leadership, the past leadership, Dr. Chrissy Zaretsky, Dr. Sharita Holmes. They all of them contributed that towards the section and advancing the section. And it was nice to be recognized with the Service to the College Award. So that happened during the Scientific Assembly, and we were very proud of our section. So.
Yeah, that's great. And all your members contribute in really lots of things. Everything we need to know as adult docs, we need to know slightly different about pediatrics, plus the dosage, plus doing the math on shift. So one of the great things about electronic medical records is I don't have to do as much math and double check it twice in these instances. Because of that, a lot of great ways to get involved, though, and a lot of opportunities to submit content. In some of it's just little pearls, some of it's in-depth reviews. And the section has been involved with some ACEP policy statements, doing in-depth reviews, but then there's also opportunities to contribute to an imaging competition and other ways. So tell me about what I can do to contribute to the section and to the field and to helping everyone out in general.
Yeah, contributing to the section should be painless, and that is our goal. And it should serve the purpose of not only is it advancing pediatric emergency care and education, but it should also advance our members that are contributing towards it. So a couple of opportunities, if I could illustrate. One is the e-images that you alluded to. There are many interesting cases that we come across. Being able to submit e-image of an interesting rash or an interesting radiologic finding for a patient that was noted, and be able to provide a brief synopsis of what the case was. And what we've done is we made it into a competition, and the top 3 get selected and win prizes at our during the Scientific Assembly. And this year it's going to be in Chicago. And so that competition, what we do is we give about 2 months. Actually, we are posting the, we are soliciting the images for this year pretty soon. The next week, the announcement would go out. And following it, the deadline is going to be by May 31st. So you will have your opportunity to submit an e-image. And not only do we all gain from the diverse submissions that come across, but also we recognize the top 3 during our Scientific Assembly, where they get to give a brief presentation during our section meeting. So there is that opportunity. And then what we've recognized is, given this time and age and our competing priorities, we don't have a lot of time to be able to read an extensive information. You want at the time, just in time, micro learning aspect of it. To that effect, what we are doing is we have selected about top 20 pediatric topics, and we are requesting members to submit a less than 500 word evidence-based pragmatic information on that topic. Our content editors are going to review the content, and when making sure all the references are in place, and then be able to post it on our section website. And this would be something that would be rotating different topics to see what is most current, what is pressing at that time. And it's a brief submission. It's under 500 words, evidence-based submission with a couple of references, and then we'll review it and have it posted for the greater good of all the members of the section.
So great ways to get involved in kind of small, quick hit. Hey, this was really cool. Let's share it with the world type thing, which is all that's a favorite one for everybody who's low on time, which is no one in this section, I swear. And so great ways to get involved with like little quick hits. Now, what if I have a great lecture that I'd just like to share with the world? Is there any way to contribute to the section through that?
Yeah, always reach out. And this is your, like I said, a professional home. We are here to support each other and gain from each other's contributions. So if there is a great topic that you would be interested to contribute in the form of a lecture, or if in the form of a panel discussion, uh, we'll see what platform suits you. And if it's a webinar that suits you, we will schedule a webinar series and have it available. If it is more in terms of an um, submission in the form of article, we can have that as well. Um, you're always welcome to submit, and thereby you are doing the section a favor, but also we would love to be able to network with you and be able to grow both the section and the members together. So
And there's a database you can go to as well. You can submit your name, and then if you've got a great idea for a lecture, and then the section as well has a lot of topics that are available with great speakers behind them. So connecting
yeah.
the educators to the administration and conferences to really educate the world.
Yeah, so there is a speaker database. Thank you for alluding to that. There's a database as part of our section where we maintain speakers, their areas of interest. So, and then either if you are looking for an opportunity or if you're looking for a speaker based on that area of interest, you'd be able to review the database and be able to network and benefit from it. So.
All right. Lots of great ways to join. I love it. What advice would you give someone in their early career who's looking to get involved in pediatrics?
That's a great question, not only in pediatrics and just in terms of um, how we get involved with the college. I think I'll speak for myself. It is important to get beyond that initial inertia, if you may. Just take a step towards joining a section, uh, attending a meeting, contributing in whatever small way you can. You would be surprised as how those small incremental steps go a long way in you growing your career, in you taking up leadership roles, and you leading the section and creating a vision as we move forward. So, but it all begins with that small incremental step of getting beyond that initial inertia and just getting involved. Get involved, network. Um, Reach out and contribute in whatever little way you can. And before you know, more doors would open up and you would get in to choose the opportunity that aligns with your interests. And I can almost guarantee you're going to thrive in that field because you took that initial step of wanting to be involved.
Wow, what great advice. And really, it's just step by step kind of gaming momentum. So the first thing to do is just visit the website, join the section. Then you might find yourself contributing in imaging, contributing in abstract, maybe doing a lecture, presenting at the section, getting a mentorship, and maybe becoming a leader in the section in the field in the future.
Yeah, yeah. That's it. Yeah.
I can see that your enthusiasm is infectious. I can see why you love working with kids.
Thank you.
Um,
Yeah, it's a joy. It is something that keeps filling the cup, if you may. Being able to care for kids and also network with professionals who are in the um, in the aspect of advancing care for the kids. It's a joyful place to be. So
I used to think when my kids were young, I would go to work just so that I would talk to adults. I think that sometimes now that my kids are older, I need to go to work to talk to kids because I talk to too many adults. Well, thank you so much for being here with me today. Great section, lots of contributions, lots of easy way to start, get involved. I wanted to end by asking you about the Symposium by the Sea costume contest for the Sonocyte Wars. What's your favorite costume?
oh, every year something wins. I mean, they they keep raising the bar every year. I really love the Mario Kart team.
Ah,
Oh, that was we had everything. We had Luigi, and every character from Mario Kart was there, and it was so much fun. So
wow, that takes a whole lot of coordination even beyond. So I'm glad that there's a lot of fun going on there. So
yeah,
thank you for putting that on. Thank you for being here. Thank you for being chair of such a wonderful and widespread section. And thank you for contributing to everything in the specialty in general to help just everybody who comes through the door who is not just a small adult.
no, thank you. And I wanted to thank you for providing the opportunity to share some of what the section does. And I want to share my gratitude because the section is about its members and it's only as good as its members. And we are proud of the members that are part of the section. We welcome all of you to join our section and uh, we look forward to partnering with other sections to be able to keep advancing and synergistically grow together. So thank you.
Awesome. Members are, and you can be a member. All you have to do is click.
Yes. Wonderful. Thank you.
Thank you.